friends, I am Dr. Natesh. I am elected member from South Zone to CSI Bangalore. It gives immense pleasure when to see a national program full of lot of academics from all over India of a higher caliber, that too in a difficult times of COVID. But it is very essential to refresh and bring the new knowledge back into all the Cardiological Society of India. So I will just give a carry home message of my talk, that is thrombotic and thromboembolic complications in COVID. How I am qualified to talk about this is I am not only a COVID warrior, I am a COVID survivor. So when treating patients, we all get into the risk of acquiring COVID. I was in ICU, I was on ventilator, probably I will come back to give this talk or the lessons which personally we learnt. So there is a strong association between elevated D-dimer levels and poor prognosis, and concerns have risen about the thrombotic complications. So when we are treating COVID, we should look for thrombotic complications and thromboembolic. In fact, the pooled evidence incidence rate of venous thromboembolism, that is DVT, is as high as 7 to 18%. In ICU cases, the venous thrombosis complication as high as 21%, pulmonary embolism of 16.5%, and DVT was present in 42.4% of patients with pulmonary embolism. So close monitoring of D-dimer levels in combination with clinical findings should lead to further decision making. Consider wherever possible CT chest and CTPA, and in severe COVID-19 cases, use of prophylactic dose of heparin is associated with improved survival. When imaging is not feasible, a therapeutic dose low molecular weight heparin without imaging can be considered when the risk of bleeding is acceptable. So when treating COVID, COVID is a very new disease, all are concentrating on the pulmonary aspect, but as a cardiovascular or a cardiologist, we should keep in mind the thromboembolic complications and thrombotic complications and take care of our patients. All the best and good wishes in near future. Thank you, Dr. Natesh from Bangalore.